Okay, it's recording now.
All right. All right. Started this evening. Thanks everybody. I just wanted to thank Boulder County Commissioner. I want to first say thank you to Lyons, Town of Lyons, and their for hosting Dolores with all the staff with the Town of Lyons was here. The get staff and Nick Homelessness is with our commissioner's office. So thank you all for making that IT work and getting us together. So we're here. It's October 30th. And 2024, we're here for the Consortium Cities meeting. I want to check really to make sure everybody has the agenda. Out again in 48 hours. Just check your emails from. So thank you. So let's start and we'll go around and do introductions. I'm going to start with the mayor since we're in your house.
Thank you. I'm Holly Roden, Mayor of Lyons. Welcome. So glad to see so many people here. I thought it was going to be us and 15 sandwiches. So there are sandwiches and chips and drinks and whatnot right there. So please help yourselves. And if you need the restroom, it's out that door and just to the right. You'll see the sign that says restroom. Thank you for coming.
Thank you so much. And we'll go instruction and then we'll jump with folks online as we let people in.
I'm Deb Fenny. I'm city council in Bristol.
John Place, City Council 1 month.
And I'm Susie Bearing, also City Council 1 month. I just came in for the homeless discussion and on that your council or so.
Yeah, thank you.
To answer any questions and yeah, listen in.
Appreciate it.
I'm Jonathan Kane. I'm the town admin in Netherlands.
Hi, I'm Nice, assistant to city associate Boulder.
I'm Lauren Folkett, City Council for City of Boulder.
Hunter, lead member from the lot, observing.
Thank you.
I'm Nick Robles, policy analyst in the Boulder County Commissioner's Office.
I'm Christine Bubble. I'm from the Area Agency on Aging and Community Services of the county.
Also with it.
Thank you all for being here. All right, let's go online and we'll go with Dion and then Vicki.
Hi, good evening. Dion Fenning with the Longmont Office of Emergency Management.
Thank you.
Hi, Vicky Ebner, City of Boulder, Housing and Human Services.
Thanks for joining us. And then I'm going to put your help because it's got really.
Oh yeah, sorry. We have Megan Newton and Councilmember Wong.
Hi, Megan Newton, City of Boulder, Housing and Human Services.
Thank you.
Hi, Brian Wong, City Council Lafayette.
Joining.
And Councilmember Delgadillo.
Hey everyone, I'm Paloma Delgadillo. Divers froze for a second. Hey everyone, I'm Paloma Delgadillo. I'm on Broomfield City Council.
Thanks for joining. Councilmember. Water Superior rep and then another county rep.
Vicky, introduce yourself.
I did already, thanks.
Thank you.
Jen, sorry, I don't know if you heard me. If you want to do yours and then Heidi.
Sure, thanks. Sorry, no, I didn't. Hi, I'm Jen Cowish from the Town of Superior trustee.
Thank you.
Heidi Grove, Boulder County Housing Department, and I think MJ is the last one.
MJ Adams, Town of Erie Affordable Housing Manager.
Thanks, everybody. I'll try and keep my eye out if there's somebody else that joins. We'll give them an opportunity to introduce themselves. So we're going to jump in here, and my goal is because there's some concern about weather and potential snow and driving and all those good things. If we get done before 8, that would be a collective opportunity. Throwing that out there. We typically take a break at 7 o'clock just to stretch and connect and do any with folks that you want to chat with. Feel free to use the chat and we'll keep our eye on that as well if there's anything that you're wanting to jump in about or if we aren't seeing you. And we'll try and be paying attention to that as well. So we have, as folks who've been part of the consortium know, the opportunity to do some really work sharing in regards to specific topics that folks are wanting to share about. So that is where we're going to start, is on our member presentation. So I'm just looking at the agenda. And then we have had on our agenda for quite a while the regional minimum wage update. So this is no longer the working group, but it's an opportunity for people to just hear an update about what's happening regionally. We had a few emails with questions, so I'm prepared to respond to those. And then I do want to talk about on that piece, if we want to continue the space on the agenda for an update or as needed. And we do have a presentation from Aging Well in Boulder County in regards to their data and report that was sent out ahead of time. So that's the plan. And if we have time before we close out, we'll share out any great events that are happening in anyone's community that they want to share about. So that's the plan. Anything I missed on the agenda that people were expecting to and are needing to speak to? Okay, thank you. So we'll start on our presentations. Friendly reminder, it's harder for those of you who are online. We can't nudge you or elbow you, but if you can keep around 7 minutes of your presentation and leaving some time for questions, and that time will be great too, so we can hear from everybody, just to keep us on in line with the timing. So I don't have a list of who is RFP. I don't know if you got any RFP specifically, and if you want to help with it, otherwise we'll just go around the room.
Yeah, I have presentations from 3 regarding the homelessness presentation, so we can sit there or online.
Yeah, well, let's work on,
Okay.
Who are your first three that you've got presentation?
We can start with Boulder County, sorry.
Perfect, all right, Boulder, you're up. Thank you.
County or city?
County's fine.
And you're driving, Nick?
Yes, let me.
All right, we'll start Boulder County and then Boulder City.
Oops.
Will you all see in the presentation on the computer? No, not yet.
Let me choose a different screen share option.
So I guess while we wait, so for those who may or may not be aware, we've been doing regional convenings around homelessness across the county, hosted by Commissioner Loachman. Those launched on May 8th, 2024. And didn't want to do a presentation all over again from May. So I know that Nick did send out the PDF of those presentations. And if you guys have any questions, please let us know. So homeless response in Boulder County, to answer the direct questions, we define homelessness in alignment with McKinney-Vento and HUD, as there are standards to the definition of homelessness, both from a family, youth, and adult space. We do have a robust response, and we are a member of the Homeless Solutions for Boulder County Collaborative with the municipalities of Boulder and Longmont. So can we go to the next slide, please? So this was also included in the PDF. This is the allocation of the 2024 budget for Boulder County's investment in homelessness, which is approximately $18 million. And it covers supportive services, housing navigation, landlord recruitment, street outreach, coordinated entry, sheltering, bridge housing, rental assistance, and mediation to prevent those falling into homelessness or eviction prevention. Of that, as you can see in the pie chart, it kind of breaks down how much of that $18 million of investment goes into across the 3 pillars of the response to homelessness. And that little 2% is the staff support from the county to make sure that we coordinate across the county. The little chart to the right is rooted in the physical address of the nonprofits that are funded. So Boulder proper nonprofits with their brick and mortar address, Longmont, and then countywide is regardless of whether they are in Boulder, Longmont, or across the jurisdictions. So no specific targeted brick and mortar location. Next slide.
You see the update slide?
Yeah, Heidi, we can't hear you if you're still talking.
No, I was waiting for the next slide.
Is it on the?
We're looking at it, so
Yeah,
Okay,
do you have it there that you could read from?
I can read it on, yeah. So we thought we would provide an update of some activities that have occurred since May of 2024. So in August, there was the creation of the new Division of Homeless Systems and Coordinated Response in the Housing Department, kind of elevating the work that the county has been involved in over the years. We have hosted 3 additional regional elected convenings since May 8th. Those were in August, September, October. We will be skipping November and reconvening in December. Many of those in this meeting are a part of those meetings. We continue to work in partnership with Boulder County Public Health on a methamphetamine task force. There's representatives from the Colorado Department of Public Health and Environment and the Division of Housing that are working to try to address and reduce the cost of remediation, which ends up costing our housing authorities a lot. All while making sure that we are still staying true to the housing first principles. Those work have gained a lot of attention, and we're in the process of gathering data across the state of exactly what the scope and scale of the impact is, not only from the public housing authorities, but we've also partnered with the Division of Housing to look across the state for all supportive housing units on that impact. In last legislative session, House Bill 1322, which was the Medicaid waiver expansion bill, passed. And we've been actively working on looking at what implementation of that is. Healthcare Public Financing, HCPF, has submitted the waiver to the federal government, and it is anticipated that those expansions will be active come July 2025. In addition, was it last calendar year, Commissioner, that you were the chair of Metro Area County Commissioners?
Yes, 2023.
So in 2023, Commissioner Loachman was the chair with the Metro Area County Commissioners and worked really hard to align the 7 counties, so our sister neighborhood counties. Through that work, they've been dedicated to focusing on homelessness from a larger regional perspective. Out of that work, this came out on Monday. For the first time, so for context, I've been working in this space in human services in the Denver metro area since 2000. I'm not as old as that sounds. I started very young. And it's the first time in the history of all the years that I've been in this space that every single county across the 7 metro has an emergency winter shelter plan. So I think that that is a testament to the work across the Metro Area County Commissioners. In addition, and this is fairly new, in January of 2024, the City and County of Denver was added as the last final cohort to the United States Interagency Council on Homelessness All Inside. There are only 7 sister cities across the country, and that includes the entire state of California. Through the work with the Metro Area County Commissioners, we were able to expand that designation across the metro region. And that comes with direct conversations and meetings with the federal government, including the 19 agencies that comprise the United States Interagency Council on Homelessness. So we are currently working in partnership with them to expand and bring those opportunities that we've seen across this country to Boulder County and our neighboring communities. So prime example, yesterday, the state of California had a huge press release, and they received an allocation of $600 million to support their efforts as part of the All Inside initiative. So we're working to assess how we can leverage those partnerships and relationships to impact our community. Commissioner, am I missing anything?
That is a great summary, and everybody this was one of the slides that was in the pre-work too, so appreciate you reviewing it. Hey, thank you, and I just want to make sure folks know that Heidi Grove is a resource for everyone in the county, and her leadership was really critical to being able to allow me to lead that work in Metro Area County Commissioner. So thank you for that, Heidi.
Thank you, Commissioner.
So from the Boulder County side, those are the 3 sides that Heidi wanted to present. So I want to just open it up for anybody's questions or what was either sent in the packet or what you just heard that Heidi's done that.
I think it's wonderful news that time across the metro region that have a mercy plan.
Thank you. I'm curious about the methamphetamine task force a little bit. What changes have been made? So how long has that been how long have it all been working on that? And what kind of changes have come as a result of the task force?
We haven't had any changes as of yet. The task force stood up and had its first meeting about 6 months ago. And we've had a lot of energy around the state actually. So we have put together a proposal of a pilot project, and we're right now working in partnership with CDPHE, Colorado Department of Public Health and Environment, and the Division of Local Affairs, which is where housing sits under, to try to look at what's possible to do a pilot test so we can look at how do we both decrease the burden on our housing authorities, and how do we also explore new remediation techniques and strategies to decrease those costs over longer time. There is also an exploration of potential policy, but we're not really sure what that looks like. And we've explored the cost of how much it is really for an industrial hygienist and all of the remediation costs that come with that. And there's some suspicion that there might be some price gouging, but we need a little bit more detail and data, which is what we're actively working on now.
Thank you so much. That's great.
Other questions for Heidi? If other questions come up, if we go in discussion, that's great. Thank you so much, Heidi. Appreciate you being here. Boulder. I think they didn't get through, but once we just.
Yeah, and then that includes the post of that too.
Sorry about this, 1 second.
No worries. We're bringing up the Boulder presentation.
I'm not going to give him a presentation. Some excellent staff on the call who are going
I'm
to
doing
than I would do.
Okay. Hold on. Okay. Sorry, Megan. I'm taking a long time. Let me
No
try
worries.
I just don't see it.
Maybe Megan and Vicky, do you want to give? Well, I guess we already did the introductions.
We can do it without the slides. I have the slides myself. It's up to.
If you want to start and then as the slides come up, that would be okay too.
Sure. So as far as I just went through and addressed the three questions, and the first one and how we define homelessness, very similar to Heidi. It's pretty standard by the funding streams of HUD's definition of homelessness. We use that primarily in single adults, but it kind of crosses over the youth and families. But we expand the definition when we're looking at families to include McKinney-Vento, and for prevention at risk of homelessness is also included. And then as far as what services we're doing, this one I'll just the slide kind of gives you a whole roundabout, but since we're not looking at it, I'll just kind of go over the highlights. We invest in prevention funding, housing retention, so that's once folks get housed, helping them keep them housed. Housing services, that's through local vouchering programs, transitional housing, housing vouchers, as well as acquisition of actual units in the community. We invest in outreach and navigation for folks who are both in shelters and living unsheltered in the community. We invest in sheltering, both through All Roads, Together, domestic violence shelters in Havens Ridge. And then we also have some health services between New Respite Center that's come online, Certain Care, which is co-response, and then mental behavioral health through the Day Services Center, and then Tribe, which is treatment in the community. And then as far as what we use to measure success, as a larger system, we look at housing exits from the system and often compare them to folks entering the system to make that determination. But then we also use other metrics with our specific programs around street outreach, emergency shelter, peer support, housing retention, and tenant supportive services. And some of those larger categories that we're looking at is back to the housing retention, connection to services that includes behavioral health, medical, and health services, connection to income and resources like SNAP or Social Security, if that's more applicable. And then connection to the community, building connections in the community, whether that be with other folks who have experienced homelessness or be community groups or those things that just help people build support groups that we feel like enriches their lives as well as helps them maintain the housing. So those were kind of the three questions that we were asked.
Thank you. Any addition?
There's a lot more detail, of course, in each of those that we can dive into it.
Well, yeah, let's look for questions. I guess people do want to know a little bit more when I know more other questions.
Are you all seeing the slides now? Were you seeing them before? Because we couldn't see them. So I don't know if you ever saw them.
Yeah, we're looking at the measuring success now.
Okay.
And we'd see the more detailed with all the different kinds of
the circle. Yeah, because we listed all the programs that we have some investment. Obviously, the county invests in those, and as well as private donations. But it kind of goes through the whole continuum from folks who are experiencing unsheltered homelessness through the shelter, in housing, and then even beyond housing, trying to keep them.
Yeah, I do have a question. In regard to co-response. So does the city of Boulder also have, what we would consider our core teams, our lead team, where we have a public safety rather than policing perspective on how we navigate public safety in the city, as far as having those mental health trained co-responders come with in crisis situations.
Yeah, so we have two different teams. We have a co-response team, which is in collaboration with the police department, but then we also have a team that is just that is without police.
Okay.
Entirely. And so that second program is a little bit newer, and we actually haven't had our council update yet on how that's going. But I hear good things. I think as with, is always challenging with those programs. One of the things we're hearing first is around how the call center is directing calls and making sure that we've had some education efforts on that front to make sure that we're getting a higher percentage of things allocated to those teams than maybe we initially thought.
Okay.
Do you have a time issue too? Like you were running into a time where they would not, after a certain time of the day.
Oh, okay.
We were having difficulty having the core group folks go with their.
So who's filling in those positions, the FTE with qualified individuals. And for us, they actually come with a police officer. So there is a police officer, social worker, mental health trained person. And so, I was wondering if you do that as well, or if you do something a little different. I know for some people, there's trauma in you just seeing a police officer, a uniformed officer there. So, trying to navigate an individual who's in crisis, experiencing trauma, and then having a team of people in uniform and vests show up the door. I was just wondering.
Yeah, Vicky with her hand up.
Okay.
I can probably answer that question, and also wanted to mention that probably the closest thing to Longmont's LEAD program is also our HOT team, which is our homeless outreach team. That is uniformed officers, however, they are non-enforcement officers. So we do a little bit of a patchwork of all these different services to try to meet those different needs. Our CERT team, which is specifically for people in mental health crisis, not necessarily the unhoused, they do go out with law enforcement. Our care team is a little bit more oriented with a paramedic and more of a health focus.
Thank you.
And what hours do those operate, Vicki? I think, right, I don't think any of the three of those are 24/7, right? There are times where we only have police response during the week.
That is true. And I don't want to lie to you for exact times, but I know CERT does go well into the evening.
Thank you.
I'm curious about the preventive piece, because here in Lyons, that's really where we're focusing, because people are struggling a lot. So Can you talk a little bit about the kinds of assistance you might provide in terms of aside from financial assistance?
Megan and I are
So,
staring at each other. I'm sorry, Megan.
Did I hear you correctly? As opposed to just the financial piece?
Right, well, yeah, apart from the financial piece, what other services do you provide?
We have an EPRS program that does mediation. So they work with individuals and landlords, and they also can accompany folks to court for eviction. So they do a lot of that mediation type work to try to keep people housed outside of just the financial assistance.
And we do that through a fee on all rental units.
Oh.
So every rental unit pays in, I think we're just upping it, so it's around $70 a unit. And then that helps cover providing the legal services for people who are facing eviction, and some of the funding for trying to keep people, like if it's gap funding on rent payment.
Maybe that's interesting.
On the funding, that was a ballot measure, wasn't it?
Yeah, it was a ballot measure, I believe 4 years ago, about something like that. And yeah, it's been working really well. Recently we've been, in terms of sort of the financial side, the rental assistance portion, we've been running through those funds much more quickly than actually, like before COVID and during COVID, we were fine. It's been in the past 18 months or so that we've really been having a hard time helping give it out as much assistance as people have needed. And so the city has been having to add additional funds to our general fund. Last year we did that, I think, twice during the year.
And was that, is there a timeline on that? Is it like a 10-year, 15-year or something like that? That ballot measure?
I don't think it expires. Do you, please correct me if I'm wrong, but I don't think we have an expiration date on that. Because it's a fee and not a tax.
You could convince me. I haven't heard that it expires at any point, but you could tell me.
Okay. And then we're allowed to raise it with inflation.
Thank you. Are there any questions for City Boulder? Great. Thank you. Thank you all for being here. Who's our next?
Okay, we have slides from City of Longmont, and apologies to City of Boulder for not getting that screen share working very quickly. My little laptop is not used to this much. Yeah, it's also.
So City of Longmont, thanks for being here.
As soon as it's up, we'll start here.
Do you want us to do that? Is it? Okay, great.
Sure. Oh, yeah, if you want to just click forward.
Okay.
Go brief. So, we're going to be defining a couple of things in the next couple of slides in regards to a single about in regard to and families with Vento. So go ahead and click forward. So this is the first part here. It's a little bit wordy, but you can see, we've got we're trying to address the issue around when somebody is exiting the program that we're doing here. The homeless, looking at the institution. This second time I got a chance to look at this. Forgive me. So this is the sort of thing that we are trying to accomplish. We actually do, I think, a really pretty decent job because we had to take over our housing authority, and I think we're really trying to address multiple issues. We're trying to address the occupancy issue. We're trying to address the issue of keeping pace with the number of folks that qualify, and we're dealing with the issues around that every community is dealing with is meth in our units. We have done something kind of unique in that aspect, and I don't want to dwell too much on that because that's not the an overall encompassing issue, but we've actually gotten these detectors from New Zealand. Is that correct? I think, and we put in a cell phone chip, phone connecting chips to them, so that we can detect meth even if someone's gone out into the parking lot and smoked it and then come back in. It's that sensitive and everything. So it's a work in progress. The batteries were the biggest obstacle in this whole thing. But you know, that's the one of the issues that we're having, and we have utilized our next slide to be able to really do surveillance on our properties to make sure that our tenants in these locations are safe and secure, and that we have people that are coming in trying to say, hey, let me come on in. We're actually aware of it and have evidence of it, so that you know, we can help those that are really trying to you know, in the cycle of homelessness due to addiction and other things like that, and move them in a forward and positive way. You want to go to the next slide?
So, and actually, yeah, because this one really looks at how we define homelessness. So again, just like Boulder County and the city of Boulder, we use the HUD standards, and then the next one with McKinney-Vento. And we work closely with the school district. They have a liaison that works with getting students into housing. We have, you know, just families maybe who are living in their car, you know, using those resources through McKinney-Vento and following the standards into providing the housing. Then now we can go to the next slide where you were talking about what we're doing.
So, yeah, so what we're trying to do is make sure that we have the services in place to support all levels and all aspects of the homelessness, you know, complex issue in regards to the single person and the families that are experiencing homelessness, and we've worked with groups that are actually helping us with folks that have animals that you know, are traveling with them. There's
And milling.
yeah, there you go. So to get the next one, I think we said for last.
Let's go to the next slide. That talks about what we're doing, how we're connecting with you know, through partnerships with the Hour Center for homeless prevention. So the Hour Center, they work as a preventative measure with providing food and housing steady program and other rental assistance. So I think, you know, Boulder City had mentioned, you know, how they're working with that financially, and then if you want to go.
Yeah.
And then you can talk
Yeah.
more about it. Sorry.
No, see, we're back.
Taking it.
Taking it. I'm glad you're here.
Yeah.
Two teachers here.
Yes.
So, you know, so we can see the cycle here. We're working from outreach and then dealing with the individual itself, whether it be the parent of children and that whole family concept. It's really kind of an overall encompassing sort of program. We've got, you know, as you can see, we've had the Veterans Tiny House Project in Longmont. We have the Recovery Cafe, which is we were trying to get located actually in one of our, you know, Longmont Housing Authority units, the suites, and just generally the sort of things that, you know, I think we've learned from multiple different communities and in conjunction with cooperation with the county and other and Boulder, of course, to see how, you know, what we can do and what actually works. And that's probably a big aspect of our approach to dealing with the in-house.
And it is collaboration with agencies that we don't necessarily fund, but we collaborate with. So the Veterans Community Project, even though it's not funded through the city, we do work with them in coordinating individuals. And then the lighter blue, those are actually agencies or entities that the city of Longmont does fund. And then we have the green, which is the emergency severe weather sheltering. Yeah. And then the other thing, and this one I had received actually a lot of information. So we have through our LHA, we have 137 units of permanent supportive housing in our portfolio. So, looking at individuals exiting homelessness through the Boulder County coordinated entry, so it's really working closely with the county. Sharing that data, looking at the dashboards, from the county, working through the city's, Center of Excellence model around mental health, and providing clinician services at the LHA properties. So like of the suites, and then we do have coming up, actually, I think they're already, receiving people. The Zinnia project, I think the city of Boulder does have one that is the same, I think is it Bluebird? Okay,
Yeah.
so it's that same, wraparound services, supportive housing. For us, we really wanted to see something around the model, the Dolores project down in Denver, where different people at different phases of homelessness and ensuring they have those supportive services, either for drug addiction, mental illness, or just self-sustainability. And then partnering with groups like the Recovery Cafe. The suites also have a donation center for newly housed individuals, so they can get those, their basic necessities as they move forward.
Some of our design and some of our newer units are around trauma-based issues around people feeling like they can't see. They want to be able to sit on like the main level and be able to see their laundry going around in the washing machine, but not have to sit there and guard it because of the idea that somebody might go in there and grab their stuff. And so our design of some of our newer locations is based around that kind of concept. And
Thank you. Thank you both.
And Christine is a huge support and somebody that if you need to talk to, she's great. She's, in fact, last year in Georgia, they did a entire dashboard. Christina Pacheco did an entire created an entire dashboard that the National League of Cities asked them to come and talk about for preschool, early childhood, daycare, and it's just you can see in the community where there's like was it daycare deserts, and so when people are coming to us and saying, hey, where should I maybe locate this type of business, we can easily tell them that. So all these things have a tie-in, and Christina is just amazing.
Thank you. Who has questions for Longmont?
Let's see, I guess I was wondering about your sheltering services and what kind of, have you guys, we have seen a big epic and we're, even during the summer, which is unusual for us, that I'm doing tons of turnaways. I just want to see what kind of.
We have two agencies, Agape, if I'm saying that correctly, and then, and Hope. And so, so we don't, the city does not have, we don't have our own shelter. However, we coordinate with these nonprofits and a lot of them, it's in church space. So Hope actually has two sites, one in the north side of town, and the other in the south side of town, where they open up for overnight sheltering, but it's a pop-up situation. They come in at 4, they set it all up, they feed, and then out for overnight, and then in the morning they shut everything down, and by 9 a.m. they're out. So it's, unless it's severe weather, but it's really looking at the housing.
But that happens every night?
And it happens every night. Yes, and I think it's during.
You'll like go to one, it's literally almost like, if you look at, it's on one side of town one night and the other side of town on another night. And they, it's back and forth, back and forth. And
then during the day for severe weather. I know I've been in conversations with Dan Painter from that, from Hope. And, looking at the possibility of even pallet structures, something to that. But it's gonna have to be a coordinated effort with the city, with these nonprofits, and
I'll just
ideas, lots of ideas.
In the chat, I think girl had put in there that Hope is not city huge increase, just in regards to your question, and that capacity at Hope is 49 on non-weather. Other questions? Okay. Who else is 1%, I think we could do one more before we take a break. Still on the same topic. Ready? Okay, perfect.
Louisville doesn't actually have a huge issue with homeless, in the way that's being defined here. We have a couple of people who will put up a tent in open space or in a park or something, but generally speaking, it's people who are living in their cars or hang out in the library during the day, go to the rec center to shower, things like that. Or what we're referring to as couch surfers, who just go from friend to friend and family member to family member. So what we're more enforcing or trying to do is trying to keep people in the homes that they're in. And so we've got, well, for new construction of housing, we require 12% of the new housing be low income or affordable housing prices. We've also do a fee in lieu if they decide not to do that, and that money goes toward other housing concerns. We have currently 2 million that we're designating per year toward housing help, but we have Kestrel, we have a new development coming in by the Thistle Group. They're building a whole low-income development. And so all of the fee in lieu goes to building houses that are affordable. We also partnered with Boulder County Housing Authority, so they've actually taken over all of our low-income housing, and that was probably 10 or 12 years ago that they took it over, right when they built Kestrel to supplement what we had given them. And then a lot of the people moving into Kestrel when it was finished were victims of the Lyons flood. There's over half were from Lyons. Yeah. I don't know if that's still the same now. We also just passed a new ordinance allowing ADUs. So any residential property can have an ADU following certain guidelines for height, lot coverage, things like that. And we don't have a nonprofit per se in the city, but we support like the Sister Carmen Center and Bridge House, and we have 2 food banks. One of them doesn't require any information from somebody. You need food, you just come to their door and say, I need food, they give it to you. So there aren't any conditions involved with it. We also have mental health facilities. We have Centennial Peaks that's been there for, I think, almost 40 years. And Mental Health Partners in Boulder is now moving to Louisville. I don't think they've opened yet, but they purchased the building and they're in the process. They've gotten all of their approvals there. Also, the police department and the library are very involved with helping anyone who has any kind of housing issues or any kind of issue, actually. They have the resources and staff to connect people to the help that they need. So, and we also give a donation to the Carmen Center. We always have given a donation for seniors to get assistance with their utility bills, their city utility bills. We just, about a month ago, increased our donation and expanded it to any age group. But through the Carmen Center. So we just donate to the Carmen Center and they distribute the funds. We participate in housing workshops because we believe that we're always stronger when we're working together and everyone's doing the same thing. And another issue that, seeing the senior group back there, another issue that we're trying to address is keeping seniors in their homes because they face very unique situations where, you know, their property tax goes up or the utility bill goes up or whatever is going up, everything's going up and their income isn't necessarily going up, but definitely not at the same rate. So we try to address those discrepancies. That was one of the motivations for allowing ADUs. And you can finish up a room in your garage and make some money. That also provides low-income housing for someone who needs a house. I guess that's it for Louisville.
That's great. Thank you. Any questions?
Yeah, for your ADUs,
Mhm.
we have a, other is that you have to be living in the property, not, it's not associated with a rental property or anything. You have that same sort of.
You have to be living in one of the units, but, yeah, and then you could rent out the other. A friend of mine, her son and his wife bought a house, this was in Lafayette. And they lived in the ADU and rented out the house until they got up to enough mortgage that they could switch. So now they live in the house and rent out the ADU.
Okay.
But yes, the owner has to live in one of the units.
I have a question on the ADU as well. If you have any, say Belmont is a great example who has pre-approved plans. So if you do 1, 2, or 3 models, then it's the architect's already been paid for, all the engineering, you get the plan. Would you all do something like that?
We have not done anything like that because, well, there is one neighborhood that's going in now that is allowing, I think it's 4 of the units will have an ADU in new construction. And so whoever buys or rents that unit can rent out the other unit.
Okay. The other one I've heard about from, we're doing some work with Strong Towns is all just in a separate, in another group on there. And so I'm curious about if y'all looked at duplexing as well, and if there was any zoning pieces that Louisville's looking at, or people who are to stay in their home and no longer have all their rooms filled, and so many apartments or duplex separate than the ADU specifically.
Not specifically, no, but as you know, the governor's new ordinance law says that any residential designated lot in the state has to allow up to a duplex.
So you don't have to
ADU
do
or
any new
duplex.
zoning.
No,
It just automatically.
it's went through from the state level.
They have to allow an ADU that's built in, an attached ADU.
But they also have to allow for up to a duplex on any residential, new construction on any residential lot has to at least allow a duplex.
But what about standing inventory where people are already feeling the burden?
There isn't any requirement on that. And if it's already an existing house and you want to add the ADU, then you have to go, like I said, through, the height requirements, the lot coverage. There's some design things where, it has to look like the house. But if you're going to put it in up above your garage, it will only be the height requirement.
Thank you. Any other questions? Who else do we have tonight that's wants to present, just to have an idea of timing, so I can look at the agenda while we take a break? Lafayette, are you?
Yeah, it's a basic overview. Obviously, as a smaller community, we really do everything very similar to what Louisville's doing. So certainly I can share some of that, but just know that I probably won't need more than a couple minutes.
Okay, I appreciate that. And is there anybody else? I had heard, I saw Ken yesterday up in Jim's home, who was planning to make it, but maybe he wasn't able to. And I can see I have.
MJ.
MJ, okay, so we'll hear from Erie and Lafayette when we come back, and then if anybody else jumps in, that's like that. I was just trying to time here, so I'll look at the schedule. So let's go ahead and take our break. It's 6:56 right now, so we'll meet you back here at 7:06. Folks online, we'll try and turn off the room audio, and then you'll hear me at a minute before, just to get back to your seats and all that good stuff. So thank you. So everybody else in the room, this is your chance to grab a snack or change it.
Okay, so we are recording again. If we could just get confirmation from the line that you can hear us.
I think you're good.
Yep, good.
Thank you.
So we're gonna hear from Gary Superior and Lafayette. And then we have our presenters who've been patiently waiting to share information and to respond to questions that people might have about the resources that they've got available. So thank you, everybody. So Gary.
MJ Adams, Affordable Housing Manager from the town of Erie. We don't have anything to present. I just want to share with you that the sentiment of the leadership of the town is that we want to be good regional partners. We profoundly appreciate the services that are provided in the region around homelessness. Our chief of police, who has spoken very highly of the cooperation and the support we receive when we send things out, or when we look to connect people with the services that are available. We know we're a small town, and but just wanted to be a good and helpful partner as we can be for the long term as we move forward through this issue.
Thank you. Appreciate you being here. All right, let's Superior. Council member, are you still on?
Yep. Hi.
Thank you. Perfect.
So I don't have a presentation. I didn't know I was coming to this meeting until this morning, so I apologize. But I'm happy to be the one to be able to speak to these questions. We are learning, and in our community, I think typically folks would define homelessness similarly to the slides that I saw from other folks, the HUD definition, but unfortunately in our community, I also think there are a lot of folks that just don't think about it because Superior's had a camping ban since 2012. It's not a community where we see a lot of homelessness in the direct community. So I think there's a lot of misinformation and a lack of education about how regional housing and what Superior has created in the subdivisions and the lack of space or zoning that we have here to be able to contribute to helping rather than supporting the creation of the problem. And so I think my role as a trustee, as I've been leaning heavily into this, we did a strategic we did the housing needs assessment, and I was pretty disappointed in the results. We got a lot of comments that were, we don't have a housing problem. This isn't something we have to deal with in Superior. Just a lot of really, I'm putting this kindly, just misinformed people responding. And so what I took away from that was, 40% of our community are renters. And most of the people who responded to the survey were not renters. And so from that, we are really shifting the focus to how do we get that feedback from the renters? Because I see our biggest role in this regional issue is to ensure that we keep people in housing. We have a lot of apartments. We have a lot of renters. So I see a lot of opportunity there for how we can ensure that we're educating the community and informing renters of resources that are available. And we do our best to make sure that they stay in the housing here so that they don't lose housing and then go out of our community because there isn't anywhere for them to exist here and move into other cities or the unincorporated area. Let's see. So we did recently, I was very proud, we recently voted to start a development for a 48-unit affordable senior housing in the downtown Superior area. So that really will be our first affordable housing project. And in our housing needs assessment, we did find that middle housing is the biggest issue for us. We have a lot of big single family homes, and the focus is on ensuring that ADUs are supported wherever we can put them. And we're looking at ways that we can provide resources to help families transition potentially areas in their homes that could be a basement into another housing unit. Let's see. What else? I think that covers most of it. Yeah, I'm coming into this learning about the regional issues and how I can do a better job to educate our community on how they become a part of the solution. There's just a lot of NIMBYism in Superior, and but the demographics are changing. So we are starting to see a lot of the aging population that started here in the 90s when they were middle-aged that are now needing those smaller units and going, oh, there's nowhere for me to go and I can't afford to live anywhere else here. So those people that it was someone else's problem, it's now very much becoming their problem. So I think awareness is rising, and really we're working on our comprehensive plan, and our strategic housing plan is part of that. And that plan includes a couple of objectives on improving housing options, which includes the middle housing, but also how do we support local and regional efforts, and removing housing barriers. Like, I don't know that I can bring up the let's remove the camping ban now without them chasing me out of town. But for me, that's very much on my radar of something that it's frankly racist zoning and or housing limitations that needs to be addressed and fixed, and we have the duty to do that. So in my term, it's definitely a personal goal. I think what else? Yeah, I think I'm really glad to be part of this group. I'm really glad to be working with the homelessness and housing group on the regional level, and we're here to learn and do better, I think.
Thank you. I appreciate that. And it makes me think we put these topics for the entire year together in December of 23. So every December. So in case there's curiosity, and then there's folks in the room that are now working on a regional task force, and it gets helpful for everybody to hear too. That's why they've even suggest changing topics if we want to share that, because now some of us are working on it, but we didn't know that last December. So, and I also wanted just to note, trustee, in a chat, there was a question. I heard you talk about a 48 unit of senior affordable housing, but just wanted to address that. The question about your new project.
Oh, sorry, I didn't see it. Yeah, so we did in September. We just approved this project, and I believe they're gonna get started right away. And it was just really exciting to vote on that. But it's a 55 or over. There'll be rentals for now, it's my understanding, and then potentially later on down the road there may be options to purchase them. But I'm trying to remember the organization. So this is a multi like funded development. And yeah, if you have a specific, Heidi, if you have a specific question that I can answer, I'm happy to do that.
No, I just know you were super excited about it at the last meeting, so.
Yeah, it's a big deal. It really is. I mean, Superior's been talking a big game about affordable housing for a long time, and now we actually have a project like that's happening and not just talked about. So I appreciate it. Oh yeah, Penrose. Thank you, MJ.
Any other questions for Superior? All right.
I could share a quick comment just around the camping ban piece. I mean, Boulder also likes to think of itself as progressive, but it is unlikely that we are overturning our own camping ban anytime soon. To get better or worse, I don't know.
I think even just bringing some awareness to it that it exists. I think most people don't know, and they're just like, "Oh, we don't have anybody here." And I'm like, "Well, they can't be here; they get arrested." So it's not, So I think just education. I think that's a big thing in our community. Is some people are just oblivious to it, and it's there, and do whatever I can to educate.
Thank you. Appreciate it. And we've got Lafayette next.
Great, thanks. I don't have a presentation, so but I talked through the questions that were asked. So as far as definition of homelessness, we do use the HUD definition as well within our community. Really, our strategy has been to focus on keeping people within their housing. And we do that via a couple of things. So number one, we have our residents passed a health and human services sales tax that we put in place 2 or 3 years ago, that we're currently collecting funds. A lot of that looks at nonprofits that support members in our community, whether it be Meals on Wheels, whether it be Sister Carmen. I know Sister Carmen gets a good chunk of that. or any other type of, there's some mental health support systems we have out there, as well as food banks that we support outside of Sister Carmen. So that all happens through our sales tax. In addition to that, we also have to help people that may be in crisis during, we have also passed where all of our shifts, I believe, or a good 3/4 of our shifts of our police officers, we have co-responders. So they have people riding along able to help with people who are having any type of crisis, as well as looking to find solutions to help people through their either temporary or long-term, or refer them to our library or other city services for long-term solutions. And again, a lot of that does roll through Sister Carmen just because they are here. They've been such a great resource to us. I know they get both dollars from the sales tax as well as the city. In our last, oh gosh, number of budgets, we do give them money as well to help with that. So that's really what we're doing. In addition to, obviously Willoughby Corner, looking for affordable housing. We also work in connection with our mobile homes, our residents in mobile homes, and if they have any concerns, they certainly come and speak to the city, let us know how we can help intervene with some of those property owners as well. Obviously, because it is a type of housing that we do have in our community that we want to make sure we maintain. So that's kind of in a nutshell what we really work on focusing on. So yeah, unfortunately, I wish we were a bigger city so we have resources, but unfortunately, as a small municipality, there's only so much we can do. So, but we do rely on our partners up in Boulder County and Longmont to help us as well when we do have situations that are beyond our resources. Thanks.
Thank you. Any questions for that? Great. Was there anybody else that was wanting to present this? Y'all are so good. We are right on time. It makes me so happy. So we have a couple of county folks here that we heard from as far as introductions. I think you all will come up here. If you want to just come join us at the table. Let's see, feel free to share around the chair.
It's over there too.
You folks want reports?
No, I'll sit right here, but I was just gonna, if anybody wants to pass it around.
Oh, okay.
Well, I think this may be yours. I do. We get to see each other all the time. There you go. Can you full screen that?
Yeah, sounds really easy.
Yeah.
How
about view?
Let's see.
That's great.
Okay.
So for folks who are not in the room, Christine and Lindsay brought some actual like physical copies of this data report. So if people do want that, just reach out to Nick when he sends the reporting over, and we'll make sure that happens.
Absolutely.
Okay, and take it away.
Okay, great. Well, thanks so much for having us. I'm Christine Vogel. I'm the division manager for the Area Agency on Aging under Community Services at the county. And Lindsay Nell is the Aging Policy Advocate and Planner at the AAA as well. And we're titled right. And so thanks again so much for having us. We wanted to come and talk to you about the updated Boulder County Aging Report, data report on aging, I guess I should say. Really every 4 years, to set some context, we update the report in terms of older adult data, caregiver and veteran information in the community. To set the context related to that part, every 4 years, we have to update the State Unit on Aging under the Older Americans Act, an area plan that outlines what we're going to do for services in the community related to older adults. We also do a survey. We do a key informant survey. We have community conversations, and that's a cycle of every 4 years in order for us to do planning. So we thought what would be helpful before we get into the specifics of the summary of the data is to just review quickly what an area agency on aging is. So we could go to the next slide. So an area agency on aging is mandated under the Older Americans Act, which passed in 1965. It's a federal designation. Through this area agency on aging, we receive federal and state monies under the Older Americans Act, the Older Coloradans Act. And through that, we provide various meals with our main mission, which is to help older adults remain in their home or their community of choice. So that could be all on the continuum of meals, transportation, health promotion, all kinds of services, caregiver support. And really the intention is to provide it to those most in need. We do that by contracting with community providers, nonprofit providers in the community. We also provide some of those services internally ourselves. The other responsibilities that we have as a AAA is advocacy, planning, outreach. We also convene and connect with our municipal partners. So in all of the senior services that are across the county and all the cities, we collaborate and work together with our partners there related to older adults. Some of those are at senior centers individually, some of those are at centers, the senior program. We can go to the next step. So AAA, there are 16 in the state of Colorado. Boulder County has its own region. Here are the other remaining 15, and you can see some of them are single county, some of them are multiple counties. What's important to note about a AAA is some are connected to their county like we are, some are a nonprofit, and some are under their council governments. So there's a huge variety in terms of the 16 that are in the state of Colorado. And in terms of the United States, there's 600 area agencies on aging. On the next slide, thanks, Nick. Again, here are just again the services to sort of review again around transportation and meals, benefits enrollment, which includes veteran service officer, veteran benefits, Medicare enrollment. We provide non-medical in-home services, caregiver support, legal services. There's a large continuum. Go to the next slide. And we have our own resource line, which we want to make sure we have here for you. Anyone can call, an older adult can call, a child, parent, caregiver, and we will provide information and referral. And certainly we have information on bouldercountyhelp.org, which you can search and look up information in terms of services. So with that, what we'll do is transition. That's just overall a AAA and a high level of review of what we do. And then we'll transition into the specifics of the data. I'll hand it over to Lindsay.
Thanks, Christine. Thanks, Nick, for driving. So what's on the screen right now is our projected growth in Boulder County. This is data from the Demography Office. That top blue line is our 60+ population projections. But I'd really like to point out the gray line at the bottom here. So right now in Boulder County, we have about 11,000 folks who are 80+. And by 2050, the State Demography Office expects that number to be just over 38,000. I'm not saying that the needs of people who are 80+ are homogenous, but our system has to change, knowing that this is one of the metrics that tells us different needs that folks might need. So more that in-home service, more long-term care services and things like that are going to be needed as our population continues to grow. 2024 marks the last of our baby boomers turn 60. So by January 1 of this next year, all of our baby boomers are going to be 60 months. Next up, please. Here's another just demographic. Yes. Oh, wow. I've never been asked to do that before. I'll do my very best. Okay. So in terms of just demographics overall and for our 60+ population, there's a few things that I want to point out. Again, this is Boulder County. This is just census data, so take it with a grain of salt. But our population for 60+, let alone at a higher rate than our overall population. We have a higher number of veterans in our 60+ population. Living with a disability, you have a lifetime of fun and adventure or illness and a combination of these things, and you're going to find yourself at a higher rate of disability as you get older. Of course, a lot of folks 60+, or a higher number of folks 60+ in the labor force. And, we've heard a lot of discussion about homelessness today, and I just really want to talk about housing cost burden too and what you see there. So housing cost burden is, of course, experienced by homeowners as well as renters. But for folks who are 60+, who are renters, who are housing cost burden, they're on that fixed and limited income a lot of the time. So those pressures and rent increases can be even higher and more devastating for some part of their population. Next slide, please. So to go more into what you'll see in the data report, we have some broad themes that we really filter into everything that we talk about. Ageism, both internalized, the way that we feel about ourselves and aging, and societal ageism, which was really perpetuated within the pandemic. Dementia and a growing number of people living with dementia in our community in Colorado, across the nation. And that's just a product of having an increasing older population. Racial equity filters into every piece of what we're doing here. And there's a desire to age home and community for everyone, and especially for older adults. That's what they told us in our quantitative survey. Increased funding is needed to provide any of these services, and we've really experienced flat federal and state funding, or nearly flat state funding for about 5 or 6 years now, with a growing population and things costing more and inflation, all the things. And then we know what's good for older adults a lot of time is good for everyone, and I'll talk a little bit more about that as we go through. Nick, next slide, please. So here are some of our priority areas that you'll see outlined in the executive summary of the data report. Aging and home and community is so important for what we do. We're not going to build a ton of long-term care facilities, and not everybody needs to move into those anyway. And aging and home community helps support not only family and unpaid caregivers, but are paid and of course are providing that care as well. And that leads nicely into our next priority area, supporting those caregivers. And then you hear it in every area, aging and outside of aging is housing and transportation are really critically important for people to be able to access the services they need. And on the transportation front, really, the way you navigate your community can change as you get older too, and retire from driving and rely on other transportation and transit services to get you where you go. Nick, next slide, please. So we shape up the data report last time in this way, right? AARP and World Health Organization domains of livability. So the first 8 of these listed here, we outlined in the data report. We've also added disaster preparedness. A lot of that is what we heard from the community, and according to World Health Organization, it's like an option that we didn't have to talk about as well. We know it's really important in our community. So I'm going to just share some information about a couple of domains tonight. Nick, next slide, please. Housing, not that you've heard enough about housing already tonight, but accessibility, availability, and affordability of housing is important for everybody, regardless of age. We know that the demand for those home and community-based services that help people age in their home or the community of their choice will continue to increase as we see these population changes. And we frame up long-term care, that being assisted living and skilled nursing, as a form of housing, and that those options are really limited and very expensive in our community. Nick, next slide, please. Just a couple pieces of data on that. 88% of our 60+ population in the county say the availability of quality housing in their community is fair or poor. They're not ranking this necessarily just for themselves and for those folks who are 60+, just overall. Just over half, 56% Boulder County's older adults say maintaining their home or yard is at least a minor problem. You heard a little bit earlier from a presenter about, okay, you may find yourself alone in a single family home and you would really like to move to another, another smaller property or something that's easier to maintain. That's very difficult to do across Boulder County. So some people may also choose to live in their single family home and stay there. And it may be difficult, but they may find ways to do that. And that is people's choice as well. The average annual cost for a single private room in a skilled nursing facility in Boulder County, this was in 2023, was $144,000, just over $144,000. If you look a little further into the data report, you'll see that that projected cost is going to increase much more. And as a note, Medicare does not pay for that. I don't, there's this, seems to be this very large misconception that Medicare somehow pays for skilled nursing assisted living, and that is definitely not the case. And the number of beds that are Medicaid funded in Boulder County are extremely limited. That information is in the data report as well. Next slide, please. Okay, next domain I wanted to talk about is respect and social inclusion. We know that ageism, the impacts of ageism are devastating, that ageism survives and thrives right here in Boulder County as it does in many communities. And vulnerable populations, especially older adults, including older adults, are often targeted for frauds and scams. We work really closely with the Community Protection Division and the VA, so you hear about this often. And then reported rates of elder abuse in Boulder County are low, but we know that the effects of any kind of abuse and elder abuse are significant. Nick, next slide, please. Ageism does shorten people's lives. About a quarter of Boulder County's older adults reported being a victim of a fraud or scam over a 12-month period in 2022. And that is much higher. The figure was 13% in 2018. So we did see a statistically significant increase in that. And there was a lot of interesting scam work that came out during the pandemic. So I'm assuming that is sort of related to that and people being in their homes. And the negative stereotypes of older people are dehumanizing and contribute to making violence against older people more permissible. It's older abuse. Okay, next slide. So that was a little bit on the domains. Also within the report, we go over a number of subpopulations. This is just
what we decided to do. This isn't really driven by AARP and World Health Organization, but we want to do specific call outs to certain populations. So again, I picked just a few to go over here, keeping an eye on the time. Next slide, please. Thank you. So for family and informal caregivers, now I'm gonna totally mess up this quote. Rosalind Carter, you either were a caregiver, are a caregiver, or going to be a caregiver, or somebody, or be the recipient of care at some point in your life. So we're all impacted by this at some point. So this is talking about our family informal or unpaid caregivers. So the share of family caregivers is decreasing. A lot of that has to do with family size choice that people that are baby boomers especially have got to choose in their younger years. We know that caregiver stress impacts health and well-being, and that caregivers experience financial and employment challenges with long-lasting impacts. Nick, can you move the next slide, please? In 2016, there were 7 potential family caregivers per older adult in the US. By 2030, it's estimated there will be only 4 potential family caregivers per older adult. And it says potential because we don't know what those familial relationships might be. That might be not a connection or automatic, like, okay, this is going to be the person who provides the caregiving. But this is still a substantial decrease in potential family caregivers, and the rest of the system have to pick up and support folks who need caregiving. So nearly a quarter of American caregivers say caregiving has made their health worse. And we see that quite a bit in our own world. So we do have caregiver programs and caregiver resource specialists supporting our family, informal and unpaid caregivers right here in Boulder County. So the fact that on average caregivers spend about a quarter of their annual income on caregiving expenses underscores the substantial impact that caregiving can have on one's finances. And that impact is even larger for younger generations. So if we're looking at Gen X versus who's behind me, next millennial, Gen Z. So Gen Z would feel that impact even more because they've had less time to accumulate wealth or to increase what their income might be. So we see that impact even larger on these younger generations. Okay, let's go to the next slide now. Okay, so talking about our paid caregivers in our direct care workforce. So the longstanding shortages, they were already in place. They were exacerbated by the pandemic. And the cost of living in Boulder County makes it difficult for these paid caregivers to live in this community. So they may choose to commute in, or they may choose to take their work into a community that's more affordable for them. Next slide, please. The median salary for our personal care aide in Boulder County is nearly $35,000, and our self-sufficiency standard, I'm assuming everybody in here has probably talked about the self-sufficiency standard. Okay, great. So the self-sufficiency standard for a single adult in Boulder County is $41,000. So it's pretty clear that these numbers don't meet. And then self-sufficiency standard for an adult with a preschooler is $80,000. So if you're trying to work as a personal care aide in Boulder County and hoping to work maybe just 40 hours a week and you have a preschooler too, this is absolutely not going to work. The budget just doesn't work. Okay, next up, Nick. Okay, agers. So as we were talking to folks in the research as well, agers emphasize the need for developing a support system and knowing about available resources to age well. So if you don't have a family or unpaid caregiver who can really provide that support, you have to look out. We have to look outside those resources. Solo agers are not only those who do not have children or family, they are the person out of partnerships who will live longer, and they are the people who do not expect to be cared for by family. So I just want to level set that, that it doesn't always have to do with family choice. Next up, Nick. So these are some examples of the things that a solo ager might have to outsource, where somebody who has family or unpaid caregiver might receive those services. So there's one quote that I like to say in all of this is, prior to boomers, most people married, had kids, and remained in the town where they grew up. There were fewer divorces, earlier and quicker deaths, and closer relationships with family. With the boomers came the pill, women's liberation, equal opportunity legislation, and easier mobility. The rate of childlessness, whether by choice or by happenstance, almost doubled with the boomers and has remained high in subsequent generations. So yeah, in broad strokes, these are the types of supports that a solo ager might find themselves needing, and that in-home medical and non-medical care around activities of daily living, and outside of that, also the long-term care resources like assisted living and skilled nursing. Nick?
That was fast. It is.
Well done.
Yeah, but there's a lot more. It's like
Yeah.
55 pages, so,
Yes.
but please at least read the executive. But that's just like a snapshot of what you'll see. And, like I said, like, okay, we have, a call out to, mountain residents, mountain older adults, and we've been talking a little bit there about especially a strong desire for mountain residents to stay in community and some lack of the resources that you might find there as well. And then I have a municipal data overview in the back as well. So for those of you in some of these large municipalities, you'll see some comparative data if you're interested in that. Yeah. Cool.
Excellent, thank you for being here.
Of course.
And for bringing the source.
Absolutely. Take as many as you want, and we can always avail around.
And our trustee found it online.
Perfect.
Thank you.
Yes.
Appreciate that.
Cool.
Who has questions for Christine?
Hey, thanks so much for coming here. You know, Lyons, we have our Walt Self Senior Center, which we love.
Yes.
It's great. It's so great for people to be out. As we all know, it's really hard to downsize, as we've all been talking about. So having an option in Lyons is so important for the people in this community. And I just looked through this, and I'm gonna make sure that all the trustees read it. So don't worry, you can come and give us a talk, please. But just flipping through the data overview and seeing that Lyons and Jamestown and Warden were not included in these, is that because it was hard to get the data?
Sample size, yeah.
Sample size,
Yeah. It all has to do with that. We, in the past, we have been able to just draw a line in the data and say, this is like the mountain overview. But I will say, because we have 2 dedicated resource specialists in Western Boulder County, we have a pretty decent sense of like what's going on with older people seeking services. Because we have Amy at Walt Self, she's one of our employees, and then a new employee, Renee, who's in the Netherlands. So even though we don't have that quantitative data, we still did our community conversations and had that qualitative pool. And then we have yours and resources on the ground.
That's great. And, you know, I'm glad to see that you had disaster preparedness on there, because one thing we heard during the Stone Canyon fire was that our residents in Walsall couldn't get out. They were told to evacuate, but they didn't drive. They had no idea what to take, what to do. There was no person kind of doing anything. It wound up that somebody who probably shouldn't have been driving drove a bunch of people out. So, so to the extent that we can work on that, I'm sure that would be really appreciated by the residents.
Yeah, so as all government folks do, I work in emergency operations, and I will take that back to our Jocelyn, and talk about that. So thank you for that.
Also to note at Walt Self, the Older Americans Act, monies that come through our AAA fund the lunch program that's Tuesday, Wednesday, and Thursday at Walt Self.
Which is excellent. I've gone there to eat.
Yeah, so it's just a great, all the different things together working to support older adults, right?
It's
So
amazing. It's really a great example of the community and county supporting. Our community.
Yeah,
Much
definitely.
appreciated.
I'm wondering if you could send us the link to where either your presentation and a link to where we can send this off to some of our constituents. If we could have that link to us, and maybe if you had a second to show us where we could find this so that we could steer people this way on the county website.
I definitely also be happy to give you one specific documentation where I put some on data.
Yeah. Both can happen. There can be specific to Longmont, and then we can also send you this presentation plus the link for the report, as well as show you where it is.
Just because I know there are people that will be really interested in.
Yeah.
You have a really great senior center. I'm really lucky to work very closely with Brandy.
I'll add onto that. Louisville has a great senior center too, and
Yes, you do.
a lot because of what you guys support us with. Not just the money for the meal site, but all the programs that come and instructive things. And you were talking about all the scams and frauds. Our police department just put together a presentation for the seniors on how to prevent scams and frauds. And it's amazing. And we're going to try and record the next one so we can post it online.
That'd be great.
I hope we can.
Hey, I just wanted to say hi, Jen from Superior. We just stood up a pretty robust senior programming in our through our community center, so I'll make sure that this gets there as well. But I just want to say we all in this room, I'm sure, go to a lot of meetings, and I just learned so much in the few minutes that you were speaking, more than I do in that amount of time in any other meeting I've been to today. So I appreciate everything that you're doing.
Yeah, thanks for that feedback. I just want to make sure folks know too on the disaster preparedness conversation, because there was a subcommittee of this group, the consortium, who committed to being part of the September national preparedness work. Our Office of Disaster Management was up in, I think where we were, it was with Monica Weber up in Netherlands, to take that show. I think she was going to they'll receive invitations to, and Dion, also, we did a presentation in Longmont, at one of the events for the Neighborhood Group Leaders Association. So just to make sure y'all know that you're in different places, and we appreciate that connection to the work for sure.
Great. I mean, everyone else got to do a shout out to their senior center.
Oh, yes. Yes,
Boulder
you can do that too. Yes.
Senior center also. Oh, two, yes.
Yes.
The one by the library had like the best deal on town on lunch.
Yes,
So,
yes.
so if
It's
you
a good
ever
lunch.
need a good lunch in
Yes.
Boulder for a reasonable price, I highly recommend it.
Yes.
You also get to like meet some pretty cool people. So.
Definitely.
Yeah, there's
Yeah.
silver
Yes.
tables.
Yeah.
Yeah.
I used to work
in the building when I worked in the city.
We didn't mean, I'm glad to include everyone, all the senior centers.
I'm a monster, so I have to like the biggest. Well, most people just don't know that, like,
Right.
like,
And like much goes on there. Yes.
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 At the senior
Oh,
center.
totally. It's
It's
amazing.
so good.
Yes. So
That's
true.
what they say.
Can anybody just go?
Yes. This goes, you can put it.
All right.
All right, so we have two things happening around the room. A lot more than two. So I'm gonna ask you, Councilman Brokers, if you will send the info about that lunch deal.
Yeah.
Recording, problem solved, everybody. And we have two things. We have time for minimum wage. I think it might be a very brief update. And then some opportunities for people to share out community events. We have less than 10 minutes, and we have 8% battery left on this computer. So we're gonna be fine. But I just want to let you know that's what happened. So
Well, I lose the audio if I disconnect.
So
So
minimum wage update, and I saw Taylor come on screen. I was gonna read your email, but you're here, so if you want to share, that's amazing.
Hi, everyone. Taylor Ryman, she, her. Normally, I like to be there in person to join you all, but I am virtual today. City of Boulder, just a couple weeks ago, the date is failing me though, passed on first reading minimum wage ordinance. And we are approaching the second reading and final passage of that ordinance on November 7th. So next week. I'll speak to Boulder's ordinance and what Boulder has planned in terms of theoretically if that second reading does pass and things like that. But there are other communities online that I don't want to speak to what's happening in your jurisdictions if you wanted to come on and share for yourself how those discussions are unfolding. I've heard a little bit of extra conversation coming out of Longmont, for example, but anyways, in Boulder, our ordinance, it will be an 8% escalation over 3 years. So 8, 8, and 8 in 2025, 2026, and 2027. So the definition of worker, one of the conversation pieces that council spent a lot of time around was the inclusion of unemancipated minors, whether they should be included in that definition of worker or if something else should be structured for them, kind of like how the city of Denver does with youth programming done by the city. And council decided to include unemancipated minors. So that was one major decision point. The enforcement of the policy will defer those needs to the existing channels at CDLE.
Oh, and the last major decision piece is after that 3-year escalation schedule, we would index thereafter annually with CPI-U. So we're coming up on that second reading, and once it's passed, it's sort of a done deal.
Awesome. Thank you. Let me try to change the audio real quick. 1 second.
Did we lose Juice?
Okay, we can hear you still. So if there's anything else you wanted to add, please go ahead.
I think those are the major highlights. And I'll look to, well, I won't look anywhere because I can't see the room now, but I'll verbally signal to Councilmember Folkerts to see if she has anything else she wanted to add.
I think that was a pretty good summary of where we're at. And in the interest of time, I will allow other communities to share out where they're at. Thank you so much, Taylor.
Thank you, Taylor. And for folks online, we can see you until we get finished connecting up here. And then I did want to respond because Councilmember McCoy had sent a question in pre-work, and it's on that computer and it should be up in that email. Or Taylor, if you've got it, the question was about an additional question to the previous question during the working group as part of Consortium, was around BBSD outreach.
Oh, and Safe Brain.
And Safe Brain. And so Taylor, I don't know if you're there, if you could, I don't have that in front of me now.
Sure. Yeah, we had the short answer is that there wasn't a significant amount of engagement done with BBSD. We had attempted when we were scheduling the focus group sessions to schedule a focus group or two on BBSD property. That was feedback that we got from several different folks. But we couldn't get through the administrative process of doing so within our engagement window. So we did get a good amount of students to respond to the questionnaire and to participate in focus group sessions, but we aren't able to determine whether or not those students were college students or high school students.
I wasn't really asking about college students. I was asking about the board of the school board's input. I mean, they're the deciding party in this, and they're the ones that decide budgets and stuff like that, and have interactions with have to figure out how they're going to pay employees and the impact that something like this might have on employee pay.
So thank you. So I mean, the answer was that they didn't.
Yeah, well,
do a
that
lot
was
of
only students. Yeah.
The answer to your question was that there wasn't really a lot of engagement, and then the additional was around students and different ages of students. What I do want to say really quick, and then folks, I'm sorry, I'm looking at the time, that this evening, so Commissioner Levy is the lead on the county side now. And so she has a meeting going on right now with mayors from around the region to have a conversation solely about minimum wage, with the goal that the commissioners have of still getting a regional goal after this year, and all the different folks doing their own study and presentation. So in case people didn't know that. Go ahead, Councilmember.
Oh, I was just gonna mention that one of our council members on city council just ended her term on the school board. And I forget exactly what her answer was, but basically they weren't super, the way the wage rates are and what we're talking about with minimum wage, they didn't express a significant amount of concern around how that would impact the school district, and didn't ask us to do more engagement in that front.
Thank you for that. Were there any other jurisdictions that wanted to share what's happening for them for this group around minimum wage?
So I can tell you for Lafayette, we are currently collecting questions to be provided to our staff, specifically around questions within our community that we want staff to research for us to provide information to potentially look at the topic for next year. So we don't anticipate doing anything for 26, but potentially for 27.
Okay, thank you. Great. So then the only other question I had connected to minimum wage is if this group would like to have an update again, maybe first quarter of 25, just to have an understanding of any regional work or any regional conversations, or if we want to let that, it sounds like every city otherwise is going through their own processes. I mean, you all were asking for a fishbowl activity. But I want to ask the whole group. Okay, so maybe when we do our December planning on topics, then we can make a decision on that. Perfect. Does anybody have community events, other pieces that they wanted to share out?
Holiday parade, December 6th.
December 6th, here in Lyons, starts what time?
5:30-ish.
5:30-ish, okay.
Ish. With drone, no fireworks anymore, drone show, high school kids drone show. It's amazing.
Is this the same thing?
Yes.
Oh,
Yeah, they did our 4th of July. They're good.
Oh, yeah.
And the only thing with drone is that you can't put it over like a park where people are. And so
Can't do that with fireworks either.
yeah, so
We're good.
All right.
Yeah, our holiday lights is December 14th, and we've actually approved last night at council to open up a contest for a competition among the area safe raid high schools to compete on creating our city council float. So we'll be providing an award
and like a cup sort of thing.
Yeah.
So they can take it to the next.
Yeah.
That's
Yeah.
yeah. I still that.
Yeah.
Yeah.
That's what this group is for.
We're starter, not the prize, we did prize money to have to go to their after concert.
Oh, yeah.
Oh,
Oh,
that's
yeah.
good,
There might be another.
Yeah.
Okay,
On November 2nd, we're gonna have the Ruta de Altar, the sort of Day of the Dead procession that starts in downtown Boulder. It's really fun. That will be November 2nd from 5 to 7.
Concert on Saturday.
It's starts at the new local, which is 1713 Pearl Street.
Thank you.
And we got Louisville on the 15th, our outdoor skating rink opens. And on Friday, December 6th, will be our parade of lights. And there will be treat bag giveaways for the kids.
We can contest who has the best parade of lights.
Yeah. Or we could communicate ahead of time and plan, so it's every night.
It's fun.
Okay, online.
Hey, I just wanted to remind everybody to plan some sort of self-care event for themselves for Wednesday after the election. That's all.
Yeah, thank you.
I think it's called sleep, trustee. Thank you for that. All right, y'all, I just want to say thank you. First of all, I want to acknowledge all the staff. Some of our staff already left, so I'm in the middle of an email to them. Those of us who run for office make a decision to be on call 24/7, but our staff does not. And so we appreciate you, and we can't do this work without you. So thank you. And I want to just tell y'all, this group for me has been a real honor to be part of, and we've like connected some ideas, and we've had some tough conversations together, and that's really important. And so unifying and coming together is really important, and that's actually the best goal for all of us for 2025. Times are going to get harder. The federal funding, the governor is announcing his budget this week on Friday, and we'll have a better idea of what the federal cuts and potential state cuts and the reality of ARPA is going to look like for our community. So the collaboration is still important. So appreciate all of you. And we're done. And 7:59. Thank you so much. Thanks, everyone. Thanks for hosting.
Oh, it's my pleasure.
And everybody wants to take a sandwich with